Competency number 6. So we're just going to start your actual treatment phase. So what we're going to do is, because you have right hip pain, we're just going to address your abdomen, your quads, and your hip, okay? So, and we're going to do this to help increase your flexibility, decrease pain, increase range of motion in your right hip. Some risks is that you might feel soreness and bruising during or after the treatment, because we are going to be doing some deep techniques and some surface techniques. So those deep techniques can cause a little bit of tenderness during or after the treatment. But hopefully after the treatment, after a couple of weeks, you can start maybe walking easier, running easier for maybe long periods of time, and sitting and standing will become easier as well. Through the entire treatment, you have the right to stop at any moment. Just refer back to the pain scale if you feel uncomfortable, 0 being no pain, 10 being excruciating pain. Just let me know. I'll report back to you. Some alternatives that you could do is physio. I could refer some stretches for you to do at home, some exercises for you to do at home to maybe help increase the strength of that joint. And some consequences of you not taking any choice of action is that it could actually get worse. It could actually, the pain could radiate to other joints. It could radiate up into your spine or even down into your knee. Do you have any questions?
No.
All right. Do I have your consent?
Yep.
All right. So before we begin, I'm going to ask you just to take off all your clothes except for your underwear. You can leave on anything that you don't feel comfortable with, but preferably sweater, shirt, pants, socks, bra would come off, and that's the best. But again, only take it off if you're comfortable. And the reason why we're going to do this is so that I can actually feel and palpate your muscles and making sure that I'm hitting the right landmarks and stuff like that. So when you get on the table, I would like you to get in between these two sheets right here, and you're going to put your head here, body like this, and you're going to be facing up. Is that okay?
Yep.
Is that would that be comfortable for you? All right. Getting on the table, to prevent any falling off or anything like that, you can use this stool right here. And if you have any problems, just let me know. Once you're on the table, I advise you just to pull the sheets up, covering everything, and then I'll come in and I'll drape you appropriately for the treatment. All right? So I'm going to leave the room. You get undressed to what you're comfortable with, and then I'm going to knock. And if you're ready, you give me a shout saying yes or no, and then I'll proceed to come in if it's a yes, okay?
Okay.
All right.